Asrar Sindi. I graduated from Virgin College at 2018. I worked there for 1 year as a clinical supervisor, and then I moved to Ministry of Health. I work in dental center pediatric department until now as a general dentist. Now, it's very honor to me to presenting to you this topic, which is assessment of pediatric first permanent molar. Let's start with our first permanent molar. It's key of occlusion. It's the first permanent tooth to erupt at the occlusion, erupted posteriorly to the deciduous second primary molar. Due to early exposure to oral environment and long eruption time, it may affect with caries or bulbal pathosis. In Saudi study, we found 75.5% of first permanent molar affected with caries or even bulbal pathosis. Why first permanent molar is important? It's important because it's key of occlusion. It's maintain our occlusion and carry lower facial height and maintain healthy of eruption of other permanent teeth. Sometimes we go to the general anesthesia to treat patients, to treat uncooperative patients, to reduce also length of the appointment for full mouth rehab, to provide the patient quality dental care. But general anesthesia have complication. The main complication, nausea and vomiting. The incidence of nausea and vomiting increased in general anesthesia above the local anesthesia from 6% to 14%, and many other complications. The use of general anesthesia should be measured to avoid any additional risk on patient health. Some studies show increased time of procedure will evaluate post-operative complication. The aim of our study to determine type and frequency of the procedure done on first permanent molar in pediatric patient under general anesthesia. And our objective, determine frequency and type of the procedure done on first permanent molar in pediatric patient under general anesthesia. Also compare surgery time for dental rehabilitation procedure with and without permanent molar for residents. This study conducted at King Abdulaziz Medical City in Saudi Arabia, Jeddah. All pediatric dental rehab cases under general anesthesia from 5 to 14 years old are included in our study. Only patient with non-erupted permanent molar and older than 14 years old is excluded in the study. Our study design is cross-sectional and include all pediatric patient dental rehab under general anesthesia from 2015 until 2018. We divide our data into four main categories. First category, patient demographic data, which include age of the patient, gender, date of birth, and medical status. Second one is surgical time, starting and ending of the procedure. Third one is procedure information, include date of OR, the treating physician name, first permanent molar treating service, and type of treatment, tooth and total of the treatment, and complication. Last one, surgical resident data, name of the resident, and gender, and level, and time of the surgery. Analysis, our analysis is done by our statistician, include descriptive statistics presented with mean, standard deviation, frequency, and percentage inferential statistic using t-test and ANOVA test and chi-test. Let's start with our results. Start with demographic data. There is no significant difference between male and female in our study. A male was slightly higher than female by 53.05%, and most frequent age was from 5 to 8 by 71.69%. and least frequent age, the patient more than 11 years old by 5.19%. Also, the most of our patient was healthy. Only 30.65% was medically compromised patient. After that, we divide our cases to 3 groups: extraction case, restorative case, and combination case. Most of the cases were combined case by 95.18%. And most of operator was senior level by 49.75%. In terms of time, most of the surgery took about 60 to 120 minutes, about 49.22%. And only 5% took less than 1 hour. Male operator more than female by 58.54%. And most of the operation done in morning shift. Treatment of first permanent sexes with relation with treatment type and restorative type. Now we divide the treatment type to preventive and restorative and extraction. Most of the patients receive restoration treatment more than other treatment to their sexes, first and second and third and fourth. Also, we divide the restoration to fissure sealant, resin, amalgam, and stainless steel. The most restorative treatment done in OR was resin treatment, and the least used is amalgam. According to restoration services, one service is the most common restoration services, and 3 is the least. And bulb therapy are most common treatment to the bulb in the OR, more than bulbotomy and RCT. Here we found strong relation between patient age and treatment type and restorative type. Patient age from 5 to 8 receive more preventive and fissure sealant by 84 and 84.9 and 84.5%. And patient age 8 to 11 receive more extraction by 50.60, which is the right time to extract the tooth. Also, here are strong relation between gender and treatment type. Male patient more than female patient in preventive and restorative treatment by 55 and 53%. But female patient receive more extraction by 60.67% than male. Also, we found healthy patients receive more by far preventive and restorative treatment by 68 and 72% than medically compromised patient. But medically compromised patients receive more extraction. That's because we go very aggressive with medically compromised patient in OR room. Young patient receive significantly more restorative treatment by 55% and preventive fissure sealant by 32% due to early assessment and treatment of first permanent molar. On the other hand, first permanent molar extraction was reported for 13% of the cases under general anesthesia, with significantly more extraction from age to 11. As I told you before, the exactly time and right time for extraction for this age. The aggressive treatment protocol for children from age to 11 years is indicated under general anesthesia. We found also 8% only of the cases had 4 first permanent molar extraction together at the same time in the general anesthesia. Our study reported the need of restoration and extraction among children treated under general anesthesia, and type of restoration used and bulb therapy treatment type was significantly affected by the age of the patient. Also, early assessment and prevention of children first permanent molar is must to prevent initiation and complication of dental caries and need of aggressive dental services. At the end, I want to thank my supervisor and my colleague, my supervisor, Dr. Rania Ba'uqda, and my colleague, Dr. Anoud Al-Hilali, and Dr. Ibtisam Al-Dighel, and Dr. Ranim Bashekh. And feel free if you want to ask any question.